I'm Brittany. My husband Tom and I live in Callender with our 3 children. This is Ellasyn, who's 3 months old, and then we also have Easton, who is 4, and Grayson, who is 7. When I found out I was expecting, I chose to see Dr. Olszewski because I had heard how kind he was, that he was very patient-centered, spent a lot of time with his patients, and during my pregnancy with Ellasyn, I did find that to be true. I felt like my care was very individualized. He was excellent at addressing all of my concerns and all of my nerves. So I came up to the OB floor around 11 o'clock, very excited that I was finally in labor. Within probably just about 10 to 15 minutes, my contractions got a lot worse, a lot more intense. There was a lot of nurses that were available to help me, which was nice because things moved quicker than I was anticipating. But they kept me very calm, talked me through it, and I was fortunate enough that Dr. Olszewski was able to be the one to deliver her. Early the next morning after Ellasyn was born, she started looking a little bit dusky, and the nurses took her to the nursery to check her oxygen level. So after we were notified that her saturations were low and that they were going to have to intubate her, the blank provider took the time to come and talk to both my husband and I, reassured us that they were going to take excellent care of her, and that they were doing everything that they needed to do to keep her safe. And kind of told us, even though they didn't quite know what was wrong, they suspected something was likely wrong with her heart. So it was nice to be able to get some sort of answer since we were not aware of anything like this prior to delivery. And we ended up going to Iowa City for her cardiac care, but it was the blank transport team who took us there. So even though things went much differently and much more scary than we had originally planned, it was wonderful to have a pediatric practitioner here. It was wonderful to have a whole team of nursery nurses for her, as well as anesthesia, respiratory, everybody else in-house. It was wonderful that even when she was intubated and not doing the best, they let myself and my husband come and touch her and hold her hand, where we were able to stay by her until she was transported to Iowa City.